You're taking your calls at 270-9933, diet and nutrition questions. Probiotics, there's some new thoughts on that.
Yes, so a lot of people want to get probiotics from their food. It's bacteria that we eat that does good things for us, so we want them to populate our health, our gut. But I have three rules. One is that you want to make sure that it is an unpasteurized or a raw or cold product. Once you buy that jar of sauerkraut, it's still tasty, but you're not having the probiotic effect anymore. Second, once you do eat healthy bacteria, you want to continue eating healthy and feed those bacteria. So you want to eat your plant foods, whole grains, fruits, and vegetables. The last one's kind of tricky. A lot of people will buy kombucha and yogurt for the healthy probiotic effect, but a lot of those products have a lot of sugar in them. And sugar is actually something that's not great for your gut health. And so you're actually feeding the bad bacteria at the same time you're trying to give good bacteria. And so sometimes you can cancel out those effects.
So plain yogurt?
Plain yogurt would be great. Or add maybe your own fruit in order to give it some flavor if you don't really like the flavor of plain yogurt.
All right. And supplement? I mean, they sell just the probiotics.
Right. And that's usually if you have an issue above and beyond just wanting to be healthy. And so a lot of times after somebody's on antibiotics or is sick, they will get a dose, which is a lot more concentrated number of colonies of bacteria to help kind of repopulate that gut.
But we need the bacteria. It's good
yes,
for
we
us.
do. Mm-hmm.
All right, let's go to the phones. We'll start with Bob in Madison. Hi, Bob.
Hi.
Hi, what's your question?
I got a question about I eat 3 meals a day, but I lose weight all the time.
So I obviously don't know the rest of your health history to see if there's something else going on.
I do have cirrhosis of the liver.
Okay. So you could try having, depending on your appetite, you can try doing some extra snacks in the middle there. You'd want to get your snacks to be a mix of protein and fat, not too much protein because of the liver, and just try to sneak maybe some extra olive oil on your salad, some healthy fat sources, and that will be a good source of calories. So other sources would be nuts and avocado, like I said, the olive oil.
So snacks in between.
Yeah, and it's the healthy fats are a good way to sneak in some extra calories.
Protein's hard on the liver?
It can be if you have a lot. For most healthy people, it's not a concern, but liver is one of the things that you want to watch for if you have issues with your liver.
All right, let's go to David in Mineral Point. Hi, David.
Hi, I have a question about, she was talking about probiotics, and I take Foragen 3, and my question is, if you take it every day, do you take it every day, or is there a stopping period where you shouldn't be taking it anymore?
Well, that's a really good question, and unfortunately it's one that we don't have a lot of answers to yet. Supplemental probiotics are still kind of a question. Part of it depends on why you're taking it. Like I mentioned, if you were taking antibiotics for a short term and you just need to repopulate that bacteria, once your GI system gets back to normal, you could probably stop taking it. If you tend to have a chronic condition, like an irritable bowel syndrome or just constant GI issues, that might be something that you would need to take on a regular basis. So it really depends on the reason that you're taking them in the first place.
Can you take too many? Too much?
You could possibly take too much, and then you would end up with GI symptoms like constipation and diarrhea. So if you have questions about whether you should take an actual supplement, I would definitely talk to your doctor and find out which one would be maybe more appropriate for you.
It's a delicate balance.
It is, very delicate.
We're out of time. If you're on the line, stay there. Michelle will talk to you off the air. Good to see you again.
Good to see you.